Morning, everybody. I'm glad you all made it. Thanks so much for joining us this morning. We have a treat for you and some really good information this morning. We have residents and friends from all of our Holbrook communities and Dogwood Forest communities with us this morning. So we have I'm Kelly. I'm with the newest Holbrook property here in Woodstock. We are the largest community and getting closer to opening, so it's getting exciting around here. I did want to share a quick video with you from Al Holbrook on our Woodstock community, so you all get a new glimpse at what's to come here for Holbrook. So, Keith, you want to go ahead and play that?
Sure.
Hello, I'm Al Holbrook, chairman of Holbrook Life. We're on the construction site of Holbrook Woodstock, and welcome. It was 5 years ago that we set out to re-engineer our whole company to develop buildings of light and hope. It was a God-given inspiration, and we started to put in each building things that would increase longevity and increase health. One of those was UV lighting, and UV lighting kills viruses. We also put in negative ion emission for lifting mood, the same ions that you smell at the ocean and the mountains. So friends, we have over 300 apartments on this campus, including cottages, active passionate, which is independent. We call assisted enriched, and we call memory inspired. So there's truly aging in place here on the campus. We also have a home care division. If you want to remain where you are through the rest of your life, we can provide home care. No one has the amenity structure that we have on this campus, from our full service spa to our exercise center to personal training, saltwater pool that opens up to the outside. We have a hydrotherapy pool. We have an exclusive license on that. We have wine dinner parties in the wine cellar every Friday night. We have a 3 full-service restaurants. So we hired one of the best chefs, we think, in the country, who graduated from the James Beard School of Culinary Arts. He heads up all our culinary arts, trying to provide you with the healthiest menu diets available and knowing where the food comes from. That's real important to us. And we look forward for you being a resident here at the Holbrook Woodstock.
So it's a big place, as you can see. A lot going on here. We have cottages, independent living, assisted living, and memory care. Our memory care and assisted living are both on track to open early fall. And then our independent living will open late fall or possibly January. So we're getting closer, we're getting excited. Our cottages are open and we have had residents move in. They're excited to be here and they're just trickling in as they sell their homes. And so we're happy to have them. So again, thanks everybody for joining us this morning. I want to introduce Keith Knabb to you with Affordable Medicare Solutions. He is the founder of Affordable Medicare Solutions and has some great information. This is a free service that is offered with any assistance in Medicare. So his marketing director is Raquel Benton. She's with us today as well. So welcome them both. They have some great information on what's going on with Medicare as it relates to COVID, and there's some unfortunate scams that have been going on over the last several months due to COVID. So he's going to educate us all, and welcome, Keith.
Thank you very much, Kelly. I really enjoy being here today, and we're going to have a very positive experience today. The idea of this talk is to make sure that everyone is empowered, that they understand that, yeah, we've got a virus that's going around, but it's something that you need to not fear it is something you need to respect. And so we're going to learn the facts, and we're going to learn how the Medicare programs have been improved to help people during this time period. And also that my agency has all of our services available for free. It's not just me, there's 9 of us here, and we are a Medicare resource center to provide year-round support. So when people move to Georgia or they leave their home and move into Holbrook, that they can manage their Medicare, as well as at the end of each year during the annual enrollment period, which is coming up in October and November up till December 7th. So Medicare can be confusing and the virus can be confusing. So what I want to do is make sure that we help people understand the facts and dispel some conspiracies, dispel some scams that are going on, and to understand that there are extra benefits that they don't want to overlook at this time. So I'm going to share my screen, and we're going to learn about Medicare and COVID. All right, so thank you very much, everyone. My company is Affordable Medicare Solutions, and we are speaking today on behalf of Holbrook, a wonderful set of communities, and I understand we have multiple locations of Holbrook attending today, so thank you. I teach Medicare all over Atlanta. We've done over 1,100 classes over the last 10 years. I teach at every major hospital, at Emory University, and pretty much all around North Georgia. So if you do have a church or a friend or someone else that would like to hear us speak, just contact us and we'll have our information at the end of the presentation. Medicare and the coronavirus. Let's first understand there are two terms that people get confused about. One is it's called SARS-CoV-2, and then other times it's called COVID-19. Well, this is important that you understand that just like AIDS and HIV, AIDS is a syndrome, HIV is a virus. Well, SARS is the severe acute respiratory syndrome that is caused by the virus called COVID-19. So this is a once in 100-year virus pandemic. The last time a big thing happened like this was in the 1918 through 1920 Spanish flu. And Medicare and Medicare plans themselves have responded very quickly in this circumstance to make sure that the seniors who are being affected most by this virus are able to cope and save money and not get hurt as much as possible. So let's talk real quick about Medicare, because first off, Medicare is not a monolithic program. It actually has modernized over the last 15 years since 2005. There are 2 paths to access Medicare. A lot of you use the traditional Medicare pathway, and a lot of you also are using the new modern pathway, which is where you see the HMO or PPO style of Medicare. And half of my clients utilize traditional, half use the modern side. And there's a lot of differences between these programs. The big thing is that we have a Medicare ebook and educational flyers to understand these pathways. But think about it this way. With traditional Medicare, you basically are prepaying for your medical events by purchasing a very simple, small insurance policy called a Medigap policy. With modernized Medicare, you'll instead pay when you need care, pay as you go, and there's also a bunch of additional benefits that come with most of the modern Medicare plans. If you've seen Joe Namath on TV recently, with his big toothy smile, he is telling you about your extra Medicare benefits. He's talking about the new modern side of Medicare. Now, let's talk about the coronavirus itself. This definitely started in Wuhan, China. And the thing about this virus that's different is that it can incubate for up to 21 days. And the typical time that a person has before they know that they've got this infection is 6 days. So there's 6 days, almost a week, that you're being infected and don't even know it. And that's really unusual. And the big problem with this virus is the fact that it can spread while you don't have any symptoms. Usually with other viruses, it's when you're feeling very sick and you're coughing or sneezing, that's when you're spreading the virus. This one is different. This virus is different. So it's really important. Many countries have already proven this. The United States is catching on a little bit slower, but it's really important for those people who seem perfectly healthy, who feel perfectly fine and say, hey, I'm totally good. They need to wear face coverings in public or while they're near others This is a simple thing to do. You can go to church, but just wear your face mask. You can go to the grocery store, just wear your face mask. That's not a hard thing to do. And if you feel you're healthy, you don't know if you're healthy, that's where you need to make sure you wear your face mask. Now, the symptoms. What are the symptoms that people can say, well, wait a minute, I'm not sure if I've got seasonal allergies or if I've got, maybe just a touch of a cold. Well, this virus has some similar symptoms, which is headache, cough, tingly sore throat, just a general feeling of malaise. But some cases also go to that flu or pneumonia style. But here's the biggest thing for this virus is that 60% of individuals lose their ability to taste or smell. That doesn't happen with seasonal allergies. So it's the most common way. If that happens to you and you're like, wow, I can't smell my bath soap or I can't smell my coffee, that might be the biggest way for you to know that you need to get a test. Or if any of your friends express that, that's a great signal they need to go get a test. Let's talk about what this means. This word asymptomatic, it means no symptoms. And so there's quite a few people that actually don't develop symptoms, but there's even more that just are pre-symptomatic, which means that they have just that 6-day period or so where they're not showing symptoms and they're actually spreading the virus during that time period. It's about 30 to 50% of people, so it's pretty significant, but it usually happens amongst your family or your co-workers. Somebody that you're spending time with, you're spending 30 minutes or an hour with, that's typically what happens indoors. Outdoors is not such a big deal, but indoors can be. So watch that when you're spending time with people. And data shows that about 80% of the infections are actually just mild, and some are even asymptomatic, and about 15% though become severe, with another 5% becoming really bad. And that's where the age 60 and up really start to see the problems. So let's talk about it. In the United States, over 4 million cases, and we've had 150,000 deaths. In Georgia, we've had over 3,500 deaths. And we're expecting about 2 years for this virus to be with us, but we might get some vaccines. I was watching the news this morning on Good Morning America, and they've got 2 going into testing right now. And they said they might be available in the first quarter of next year. Dr. Fauci was talking about that. He said he was cautiously optimistic. And we've got 100 different candidates being tested. So this is one of the greatest worldwide efforts ever. It's really amazing. But remember, this is many times more dangerous than the seasonal flu. And every year we have to get a different flu vaccine. So it's important that you watch this. And if a vaccine does become available, to utilize it. We'll talk about that in just a second. So what have we learned? What's the positive stuff? Well, the positive thing is that the lockdown that we did here in the United States and also in worldwide actually worked much better than they expected. It really did tamp down the virus very well. And we've also learned that children rarely get affected by this virus. As a matter of fact, under age 30 is very, very low numbers. And we also learned when we first started treating this virus, we thought it was mostly a respiratory problem, and we were using ventilators a lot. And unfortunately, ventilators, are not a great thing, and a lot of people don't do well on them. But they found out that there's some drugs that actually really help people. One is called dexamethasone, and that's a drug that's been around for 40 years. The real problem with this virus is that it causes inflammation of the arteries, which leads to blood clotting. That the clotting then affects the lungs. So now when people come in and they're having these treatments, they're putting them on blood thinners right away. And you'll stay on blood thinners after your treatments. And that really helps to dissolve the blood clots and prevent further problems in your organs. But some other things that they learned, and if you're not already taking some vitamins, talk to your doctor about this, but vitamin D3 helps. Vitamin C helps. They actually put vitamin C in the IV bags. And zinc can help. So talk to your doctor about that, about taking the proper levels of those items. A lot of older people are already taking all 3 of those. I am personally, but talk to your doctor, of course. So here's a question where a lot of people are getting confused, and they hear talk radio giving out some strange information. So let's talk about some facts. New York City, New York State did 57,000 tests recently and had only a 1% positive rate. That is very, very encouraging. Georgia right now is at 11%, and Florida is at 14%. At times, Arizona has been at 20% recently. And of course, when you do more testing, that does turn up more cases. But if testing was the reason for the rise in cases, the share of positive tests actually would go down. We're actually seeing it go up in areas. So that means that we actually are having community spread. That means that the people that are going out to bars, people that are going out for vacations or for other reasons without wearing face masks are actually spreading the virus in the community. So it's pretty easy. If you would wear your mask and not hang out in crowds, we would have a lot better success. So share that with your friends. Now let's go to the meat of the matter today. Everybody that's in Holbrook is probably on Medicare. And this is important. Right away, they said the lab tests for COVID-19 will be free. You pay no out-of-pocket costs, so don't worry about it. Go to your doctor orders the test, you're going to not have to worry about paying for that. And as these antibody tests, I think there's around 4 or 5 now that are FDA approved or authorized, those antibody tests are also at no cost. So the difference between a COVID-19 test is to see if you're infected right now. An antibody test will tell you, was I infected maybe a month ago? And if you have got antibodies, maybe you've got a little bit of resistance right now. Doesn't mean you're immune, but maybe you actually had it when you thought you had the flu, maybe in February or March. Maybe now you have some antibodies and they can test for that. And that would only basically show up if you had a pretty severe case. Mild cases aren't going to really show up in those antibody tests. If you do go into the hospital, it depends on your Medicare program what you will pay. If you have a Medicare supplement, a Medigap policy, you're not going to pay anything for your hospitalization. And under most of the new modernized Medicare HMO and PPO plans, they are waiving the hospital cost for COVID treatments. Not guaranteed. You do need to talk to your plan and look for information as they send to you in the mail or email. Most plans are waiving the cost. Now, also, if you have to stay in the hospital a little bit longer because they can't find a place to transfer you to, they will also cover those costs. But that's becoming less frequent today. We had a real problem in April and May about that. And when a vaccine for COVID comes along, 1 or more vaccines, Medicare says the FDA approved authorized vaccines will be free under the Medicare immunization schedule, just like your pneumonia vaccine and your influenza vaccine. Very good news. So some other things that are very positive that have happened is that Medicare was already experimenting with telehealth, which means talking to your doctor virtually through the phone or through teleconference like we're doing right now. And so most Medicare plans now offer telehealth services to allow you to speak to your doctor this way. You should also understand that you can take advantage of other items under the Medicare HMO and PPO programs that are free services that are delivered to your home, such as home fitness programs, also medical items delivered to your home to help you, like vitamins. Medicare doesn't cover vitamins, but a lot of the Medicare HMO and PPO plans will mail them to you for free. They have limits, but they do have some free programs. The state of Georgia with Governor Kemp did a great thing and encouraged all the programs are mandated for them to give you early refills so you don't have to go to your pharmacy and get those refills early for a 90-day supply. Not every drug, certain opioids and drugs cannot be dispensed on a 90-day supply, but other drugs, they've made it easier for you to get them and they should be delivered to your home at no charge. We already talked about the free testing under coronavirus. But another thing under Medicare was that they used to make you wait in the hospital 3 days before you were given the skilled nursing rehabilitation. Now, under the new modern Medicare plans, they never had this rule, but traditional Medicare has now waived that rule, and they can transfer you after a day or two to the skilled nursing center in order to free up beds, because you want to get those beds free for another person who needs to come in for their COVID treatments or other treatments. Now, we know that this has been a very stressful time. The mental health aspect of this pandemic is probably worse than the physical health aspect. I feel very bad for the children that are missing out on school and the college kids missing out on college, but hey, all of us are missing a lot of activities. So people age 60 and older are at the highest risk for severe illness. And one of the things that can create mental stress is too much news. Turn off the news. Maybe watch it once every couple of days. Turn off crazy social media. You can mute or unfollow friends of yours that might be spouting out a little bit too much information that might even be really bad information. Try to take care of your body. Take deep breaths, exercise, use all the facilities at Holbrook that can help you to feel robust and physically better off. Of course, you're going to eat healthy at Holbrook. You're going to have well-balanced meals, and you're going to get plenty of sleep. Yeah, you can go to the wine tasting, but maybe don't drink a whole bottle of wine. Make time to unwind. Try to do some other activities. Get a new hobby. Connect with others. My family has been doing Zoom birthday parties and been doing other things virtually, like playing games. It's been fun. I have daughters all over the United States, and we found new ways to connect with each other. But if it gets really bad, if you lose a friend, you have grief, you lose a family member, and you need mental health services, most of the plans are offering free telehealth mental health services and counseling. So take advantage of them. There's no reason to avoid it. It's confidential and it's free with most programs. So I encourage you to do that. Now, let's talk about scams. We all know that there's always a scammer around every corner. You got to keep your antenna up. And they, of course, are using the COVID-19 pandemic as a way to steal your Medicare number, your personal information, or your money. That's their goal. And you need to watch out for these criminals. And here's some scams. There are robocalls. I must get 2 robocalls a day, if not more. And they're doing such as things as offering you free masks. They're also doing social media posts, fraudulently asking for donations for non-existent charities. Facebook and other social media have been deleting millions of these. There's also fake testing kits and sites. There have been fake sites where you drive up, you give your Medicare information, and they're not even a real testing site. Free offers for protective equipment like goggles or gloves or masks. Here's one. If you're a stock investor, they're offering great inside information on stock market programs to help you to get in early on a vaccine development. Be careful about that. Talk to your financial advisor or your accountant. There's also email scams claiming to be from the Centers for Disease Control or the World Health Organization. I've seen one of these come to my email. And text messaging. If you get text messages that don't seem right, don't click on it. It might put a virus on your phone. So be very careful. How about Medicare? Will Medicare, the government agency, call you? No. Medicare will never contact you for your Medicare number or other personal information unless you've given them permission in advance. So when somebody calls from Medicare and says, hey, we're going to send you out all this stuff, I just need your Medicare number, that's not Medicare. Be very careful. They're not going to call you, and they're not going to visit you in your home. And Medicare agent can visit you, but they don't work for Medicare. They work for an insurance company, so be careful. And Medicare cannot enroll you into any program over the phone unless you have called them at 1-800-MEDICARE to do that. So be careful. Now, something that's been extraordinarily frustrating for me. I've got some very intelligent friends that have fallen prey to conspiracy theories. And there are a lot of them being hatched out there every day, it seems like. So one of the very first ones was a video that got shared millions of times from a Dr. Judy Mikovits. It's been debunked pretty much completely. Every little conspiracy has a nugget or two of truth to lead you down the rabbit hole, but it's a fake video, and don't follow that. How about masks? Masks do not hurt you. They do not reduce your oxygen in your body. They do not activate the virus in you. My daughter has a roommate who is an intensive care nurse. She filmed her oxygen concentration after 12 hours of working in the ICU, and it was identical to when she started in the morning. So there's not going to reduce your oxygen concentration. Don't worry about that. And we are not overcounting the deaths of this virus. We're actually having an undercount. So it's actually a little bit worse than what we have been tracking. 5G cell phone towers. There's some wild conspiracy theories about the new cell phone towers. They don't cause this virus. And vaccines. Vaccines are good for you, and they're good for society. Of course, there may have been some problems here and there, but on the vast majority, the modern world is better because of vaccines. And so we do want to use them. You're not required to. We do live in America. You can make your own choices, but vaccines are not bad for you. So let's talk about what some of the Medicare plans have been doing. Not Medicare itself, but the Medicare insurance company plans. A lot of them have also decided to waive costs even for the primary care or specialist visits, like I said, the behavioral health or mental health visits and telehealth for part or all of the year 2020. So talk to your plan. You can call your customer service number or call my office and we'll help you with that. Not every program, but most of them. They've also gone back. Some of the programs went back to March and reprocessed claims for people that had already paid the doctor. So people are getting checks back in the mail saying, hey, we have decided to cover your cost of that doctor visit. That's pretty neat. They didn't have to do that. There's also some of the programs are sending free safety kits and information. One of the insurers is actually sending you 2 face masks. Now they're being cute about it. They've got their logo on the face mask, but hey, it's a free face mask and wear them. That's a freebie, and you have 2, so don't wear a dirty one. Wear one, wash the other one, let it dry, and then wear the clean one. Having a clean face mask is important. Some of the Medigap insurance policies have promised to make sure that the new and renewal premiums, the monthly costs, are going to have special stability, and they're going to really make sure that the prices don't go up on a crazy basis. A couple of major companies have done that, and a couple of the smaller companies have actually had some big rate increases. So don't suffer under those rate increases. Call my office. We might be able to help you out with that. Medicare itself has also been extending special enrollment periods, which means times that I can help people to manage their Medicare. One of them expired on June 30th. We're expecting, we've not been promised this yet, but we're expecting that they're going to give us some relief during the annual enrollment period, because if people can't go out and visit or talk to their doctors, or if it's an outbreak again, Medicare is going to have to give us extra time to help people with their Medicare choices for 2021. So it's important. Medicare will let us know probably by September on those rules. So the resources, where do you get more information to make sure you're not getting bad information? Well, the great information, of course, is at our website, amsplans.com. The CDC, the government website, has great information, a great COVID fact info center. Medicare has a good center, but the really good one that I like the most is Medicare Rights. It's a nonprofit organization called MedicareRights.org, and they're kind of neat because if you don't see the answer, you can ask them a question and they'll research it and usually get back to you within 24 hours. Of course, my office will do that too, but we actually call MedicareRights.org and ask them for information. Then the last one is the Georgia Department of Health. The DPH, Department of Health of Georgia, has a really good Medicare COVID center for tracking it. It had some problems originally, and they were rightly criticized, but they've done a good job of improving it recently. So this is important that you use these websites, and this slideshow is available for us to send it to you, so you don't have to necessarily write all this down at this moment. Get to the next page. So here's our phone number, 770-945-5261. And to request a copy of this presentation, please contact Raquel at amsplans.com. Our host is Kelly Carringer from Holbrook. Holbrook has tremendous staff, extraordinarily professional, and they can also help you with different information, but they utilize resource partners like Affordable Medicare Solutions, so that we can quickly get you the right answers. So we're happy to help, and there will be no charge for our services. Kelly, I'm going to turn it back over to you. And
great information, Keith. Thanks. That was really, really good stuff. There's a lot of misinformation floating around out there. So thanks for clarifying. Thank you for to all the residents and friends that have joined us this morning. I hope you enjoyed it. Does anybody have any questions for Keith? Any questions for me, or any questions at all? Well, feel free to reach out to Keith. He is a wealth of information on this subject. And like he said, they don't charge for their services. So, you know, don't be afraid to reach out with questions. And that's it. Thank you all so much. Have a great day.
thanks for having me.